The study that we presented at ASCO GI was a post-hoc evaluation of the results of the TAX study. The TAX study was a study that evaluated the role of trifluridine tipiracil in third or later lines in metastatic gastric cancer. So this was basically a phase 3 study randomizing patients in the third line or later lines to receive the experimental drug at that time point, that was trifluridine tipiracil versus placebo. The data had been actually presented and published before in the Lancet Oncology. But what we did in here is try to see whether we could refine a little bit more the population that did benefit more from the treatment. So for that particular reason, we look at the results of the study and compare the efficacy data based on the different subgroups of patients. And intriguingly, we evaluated whether there was a difference between those patients that were treated in the third line or those patients that were treated in the fourth line or more. The analysis of this extra analysis of the study, the results actually suggested a superior survival benefit for trifluridine tipiracil in those patients that were treated in the third line setting compared to those that were treated in the fourth line or even later lines. This does not mean that those patients that were treated in the fourth line setting or more do not benefit from the treatment, but the most interesting results were seen in those patients that were treated in the third line. So if we look, for example, at the hazard ratios for overall survival, that was the primary endpoint of the study. If we look, for example, at the ITT population, the hazard ratio was 0.0.